Hello and welcome everyone to the SnotDoc video series. My name is Dr. Steve Chase. Chances are if you're watching this video, you, a family member, or maybe one of your children has recently had their tonsils out, and you might be asking yourself, what were we thinking, right? I often tell my patients it's one of the meaner things that we do to people, and I'm not joking about that. But here we are, you're in the post-operative period, and hopefully this video will be helpful, give you some ideas, maybe some hints and some education on what you can do to help you get through the next couple of weeks. So today I wanted to go over a few things. Specifically wanted to talk about why it hurts so bad when you get your tonsils out, obviously then what you can do about it, and then I wanted to talk about some risks that we see, specifically hydration, fever, and bleeding, and get a little information on those things that might be able to help you again get through this. So first of all, why does it hurt? So to understand this, it's helpful to think about the anatomy a little bit. As you all know, your tonsils are in the back of your throat. This area is area of muscle. Your tonsils actually sit in a pocket of muscle. We call it the tonsillar fossa. So every time you swallow, this area tugs and pulls, it moves, right? Now when your tonsils are gone, this area becomes a raw surface, essentially a big canker sore. So every time you swallow, it tugs and pulls on that area, and it hurts. It can hurt really bad, obviously. Now interestingly, your adenoid sits up in the back of the nose. This is typically removed with tonsils, but this area doesn't move when you swallow, and because of that, pain after an adenoid removal alone is not really too bad, at least compared to the tonsil removal. So really when we talk about tonsils and adenoid, the pain that you're experiencing is from the tonsillectomy aspect of that. So what can we do about the pain? Okay, so what can we do about the pain? I like to break this up into two parts really, things that you can do for the pain and then things that you can take for the pain. So the first thing I want to go over are things that you can do for the pain. That we break down into 4 parts, specifically ice, humidification, movement, and then distraction. So my favorite thing that you're going to hear through this video and other videos is the use of ice in the post-operative period. Ice is great. I think it's underutilized, to be honest with you. Ice decreases inflammation, which decreases pain stimulation. There's been studies that have shown that ice decreases what is called nerve conduction velocity, so in other words, how fast a nerve stimulation passes, and it's shown to increase pain tolerance and pain threshold. So I'm a fan of ice. So that's usually doing what you're always taught, right? The ice chips, the ice cubes, it's the popsicles, it's the ice cream. Those are the things that can help topically to decrease inflammation. Now I'm also a fan and would encourage ice on the outside of your neck. You know, we see this with people that have their wisdom teeth removed, have the big bags of ice that are around their cheeks. Well, the same concept can help really with tonsil removal. So you could use those same type of products, just drop them down. I typically even recommend patients just use a bag of frozen peas that you get at the local grocery store that you can put just around the outside of your neck. Again, decreases inflammation, which helps with the pain. So the second thing that I recommend is humidification. Specifically if you live in a dry climate, but really anywhere, keeping more moisture in the air can be helpful. So I highly recommend running a humidifier by your bed or your child's bed through the night. Just puts a little bit more moisture in the air and does seem to help with the pain. Movement. Now this is actually a little bit controversial. I recommend swallowing more, for instance, chewing gum, things like that. I think most ENTs now do recommend trying to swallow more. Certainly helps from a hydration standpoint, etc. But I mentioned it's a little controversial because I know in the 90s there were some studies that suggested maybe it even slowed getting to a normal diet. But in general, I recommend chewing gum, things to keep things moving as much as possible. And then the last thing that you can do is distraction. Now this is actually quite interesting. There's been some studies looking at this in a few different areas, but essentially what it comes down to is we're finding that if you distract yourself from your pain, it is less. So that's things like video games, television series, books, whatever you might be able to do for yourself or for your child, toys. If you can keep them distracted, it actually does seem to help with the pain management. So the next thing that I want to talk about are things that you can take. Okay, now to go over things that you can take during this time. So I want to break these up into two parts. Things that you can take topically or use topically to go over the raw surface, the area that's hurting, to help decrease the pain. And then of course the typical things that you think about, the medications that you can swallow that can help for the pain. So from a topical standpoint, of course, ice can apply there. But the other products that we're thinking about here are things that you can get potentially over the counter, sometimes prescribed. So these are things like lozenges, sometimes throat sprays, and things like that at the pharmacy. Most of those products have things like menthol, benzocaine, some even have phenol in them, that when you spray in the area, or if you suck on those things, when it gets back in those areas, it can again decrease the nerve conduction and help with the pain. Typically these are somewhat self-limited, but nonetheless they can certainly be helpful through this next week or two. You can also get some compounded products. Locally here we work with compounding pharmacies to make tetracaine lollipops. Again, those are the same concept, to use topically over the area that's so sore, so raw, to decrease the nerve stimulation. Now when we talk about medications that you'll take, these are broken up into steroids and then non-steroids, and then there's a category of the narcotics, of course, that we want to go over. So the steroids that we're talking about, those are things like prednisone or prednisolone. These are anti-inflammation medications, so again they decrease that swelling, which contributes to pain. Now typically the steroids are given actually during the surgery. Your anesthesia doctor will give you a dose through the IV, and so that's going to work for you for 2-3 days pretty good. Some surgeons will also give you another dose of steroid in the post-operative period, maybe day 3, day 6, etc. So I would encourage you to talk with your surgeon regarding that. Each surgeon may differ slightly on that. Now for the non-steroidal anti-inflammation medicines, we often describe these as NSAIDs, so non-steroidal anti-inflammatory medications. These are things like the acetaminophen and the ibuprofen. Okay, those two medications really will be your foundation for pain management and your child's pain management during the post-operative period. Typically these are they're taken together but alternating. It's usually recommended that they're taken in a staggered fashion. I personally recommend every 3 hours to take one, then take the other, kind of walking through the day. And generally with those, you're going to do great. I will say that pain management from a medication perspective is different in children versus adults. The reason specifically for this is that children don't do as well with narcotics. I'll discuss that in a second. But because of that, we rely specifically on those NSAIDs, the ibuprofen and the Tylenol or acetaminophen for them. For children under 12, that's what's recommended. Again, alternating every 3 hours, Tylenol, then ibuprofen. When you get a feel from their pain standpoint where they're at, you can of course bring that back, maybe every 4 hours, every 5 hours. But commonly during this healing period, you're going to have, I like to call it the roller coaster. You're going to have days when you need to use them every 3 hours, and then you can kind of relax back and forth. So again, that's the mainstay for pain management in kids. When it comes to adults, this varies slightly. Still, we rely on the ibuprofen on a scheduled pattern. You can do, of course, extra strength Tylenol as well, but generally over 12 years old, we're thinking about using a narcotic, in the pain regimen as well. Generally, again, it's done in an alternating fashion, where for an adult you would use a narcotic pain medication, which actually usually has Tylenol with it, alternating with ibuprofen. Again, typically every 3 hours, you'll take the Tylenol, the narcotic with Tylenol, then the ibuprofen 3 hours later, the narcotic with Tylenol 3 hours after that. So you get these 6-hour windows between the same medication. Again, with that, go by what your surgeon recommends. These are things that I do, which are accepted, in the recommendations from our academy. But when in doubt, go with what your surgeon recommends. Now, when it comes to narcotics specifically, there's a couple important side effects that we want to bring up, which may determine if you're able to use them or not, right? That would be nausea and constipation. So, and this really varies, from person to person. Some people have significant nausea with these medications, just can't do it. Others have some nausea but can kind of manage it. And others take it and have no problem at all. And so I would recommend if you're prescribed one of these or going to be taking one of these, that you start kind of slow to make sure you tolerate it okay without having much in the way of nausea. It also does appear that people seem to do better if you have something on your stomach when you take these. Asking your pharmacist is a good idea too. They may have some ideas of ways to tolerate it a little bit better. The other side effect though that you can get, or really the other side effect that you can get from narcotics is that of constipation. So this can be insult to injury, right? You're already miserable from the tonsillectomy. You're barely getting stuff in, really struggling, and now you're constipated on top of it. So obviously that's not a good time. Because of that, it's often recommended that you start some stool softeners. If you're going to take the pain medication, the narcotic pain medication, I'll just start it, take it while you're taking them, and that can help significantly. So pain management is so critical really because it comes down to hydration. I often will tell my patients that, hey, you don't have to eat anything for a couple of weeks and you're going to be okay as long as you stay hydrated. And there's truth to that. It's common to lose some weight, which you'll gain back afterwards, but the hydration is key, and so that's where the pain management comes in. So how do you do this? Well, it's the things that we've talked about. Obviously, it's the ice chips, it's the popsicles. You'll be surprised how well you can do, or your child can do, really with ice chips with those small amounts of things, and they'll stay hydrated, by doing so. So how do you know if you're not? The typical things that we recommend are looking at your urine. The more hydrated you are, the more clear your urine is. The reverse is true too. If it's very dark, very concentrated, it suggests that your body doesn't have a lot of fluid helping you flush that out, and so it's much darker. So the same obviously holds true with your children. Now, say you've got a little one, they're in diapers or whatever, I typically recommend that you keep an eye on how often they pee. There's different things that you'll read, whether that's every 6 hours, every 12 hours, certainly every 24 hours. You want to make sure that they urinate at least every 24 hours. And that's fairly common, honestly. It's rare that a child will get overly dehydrated. With that said, occasionally it can occur. Certainly if you're, maybe over 24 hours or close to that and they haven't peed, then I would recommend that you speak with your surgeon, kind of get their thoughts, maybe their advice on what they'd recommend. I think that it's quite rare, but every now and then we'll have to send a little one in to a facility to have an IV placed to get some fluids, to help with hydration. But again, thankfully that's quite rare. Okay, so the next thing to talk about is fever. Is this normal after surgery? It actually is almost universal to some degree that you or your child will have some degree of a fever after surgery. Fever, it's a natural body response when our bodies are being threatened by something. That's often infection. It can also be trauma, however, as well. And certainly when you've had your tonsils removed, you got those big raw surfaces, those big canker sores, your body sees that as a threat of some kind. So its response is to increase the temperature to kind of fight that off. So very common. The good news is the way we treat it is similar to the way we're treating the pain. It's with those non-steroidal anti-inflammatory medications. So it's the ibuprofen and the Tylenol. And typically by just using those for pain, that will help manage the fever as well. How high is too high? You'll again have different opinions on this. A low-grade fever, 101 or less, extremely common. I've seen 102, honestly, quite commonly, so I wouldn't get overly worried with that. But the key is just to treat it, right? So to use those medications as it was discussed. But say you're doing that, you know, your child's still hot, you've used the medications as scheduled, and they're still hot. I recommend, you know, strip them down, you know, run around in their underwear, whatever. And then if there's still fevers there, I would communicate with your surgeon, make sure that they're in the loop. I'm often recommending get a, you know, washcloth, just damp, that you can kind of rub on them just to help evaporate away some of the heat. But yeah, fever is extremely common after surgery. Okay, so the next big risk that we see, and really what as surgeons we worry about the most after surgery, is the bleeding risk. We break this up into two groups depending on when the bleeding occurs. You can have early bleeding, which is defined as within the first 24 hours, and then what's considered delayed bleeding. Now, delayed bleeding is by far the most common. That's typically somewhere between days 5 and even 14. But the delayed bleed risk is the much more common problem. The early bleed risk with some of the newer techniques, we just don't see that as often, but it could still potentially occur. So what do you do about it, right? So when you have bleeding, kind of there's two main areas that I recommend people focus on. One is to try to decrease their blood pressure, which obviously would decrease the blood flow to the area. And then the second is to constrict the blood vessels, right? And so we'll talk about how to do that. So bleeding occurs typically in this delayed fashion. We believe when the scabs are coming off where the tonsils were removed. So those blood vessels that used to feed the tonsil now open up and you have some bleeding. I generally will tell patients that, hey, expect it. The rates are out there generally across the board, somewhere between 3 and 5%. That's fairly well accepted through the ENT community, meaning kind of no matter what you do, there is that chance of bleeding. And so the key then is to kind of decide, well, is this a normal expected or is this not normal? Meaning, is this more than there should be? So how do you know if it's too much? I often will tell patients that, you're going to see specks of blood during that, typically 5 to 7 to 10 day period. Very commonly, you may even see tablespoon, very commonly. Even sometimes, you might see even more, like quarter of a cup. That's not uncommon that you can see that. The key then, of course, is to try to stop it or try to slow it down. So from a blood pressure standpoint, often we'll say, why don't you just try to relax? Well, easier said than done. When you see bleeding or a parent sees bleeding, everybody gets excited, blood pressure goes up, makes the bleeding worse, and so you get this vicious cycle, right? So as best you can, we say try to relax, try to calm, sit in just a calm environment. That will hopefully decrease blood pressure, which will decrease the blood flow to the area. Now, from a blood vessel constriction standpoint, that's when we go back to the ice, right? So ice tends to constrict blood vessels, which helps to slow the flow. So with any bleeding, I recommend going with ice chips, ice cubes, sometimes gargling ice water, back to that, bag of ice or frozen peas on the outside. Those things, along with the ice internally, can help spasm the blood vessels and stop bleeding. Generally, that's all you have to do. It may come and go over 2-3 days, but again is self-limited, quite common, and not necessarily anything you have to be overly worried about. So when do you get worried? Okay, so again, it comes to a volume and how fast this occurs. Again, I usually say, hey, teaspoon, tablespoon, pretty common, sometimes fourth of a cup, fairly common. But if you're getting more than that in a short period of time, so say you're getting to, say, a third of a cup and now it's half of a cup and you or your child's kind of leaning over a bucket and it's just going, and you've tried the ice, you've tried the ice on the outside, it's still going, that's not normal. And so if you're seeing something like that, certainly would recommend that you call your surgeon, get their advice, and follow what they recommend doing. Whether they want to see you in their office, often they'll recommend probably going to the local emergency room. But that's the type of bleeding that you would not want to ignore and is not normal. and you would want to have addressed in some way. Okay, so hopefully this was helpful addressing some of the typical things that we experience in the post-operative period. This is a rough time, there's no doubt. My advice is to hang in there. Believe it or not, once you're finally through this, I will say you're going to be glad that they're gone, and that it was worth it. And again, this video, as the others, are for informational, educational purposes only. Please don't consider this medical advice. If you have any specific questions, I ask you please contact your surgeon or your ENT provider for anything specific regarding the other things that we've talked about today. All right, and so remember, until next time, keep your nose clean.